Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about type 1 diabetes, which used to be called insulin dependent diabetes. It was generally associated with an autoimmune condition that was destroying the beta cells of the pancreas. Not to be confused now with type 1 diabetes in somebody who used to be type 2 but now completely beat up the beta cells of their pancreas and it failed and now they can't produce any more insulin. So type 1, the autoimmune condition, is what we're talking about here. Interestingly enough, the lifestyle for one versus the other, they're all the same. uh, Eating crap, not exercising is going to be bad for insulin dependent type 1 diabetes, whether it's autoimmune or beta cell failure or type 2 diabetes. And if you want to not become, if you want to be type 2 and you don't want to go on insulin, like, lifestyle is the only answer that's going to work in the long run. So the mistaken belief is that people think that once they become type 1 diabetic from an autoimmune standpoint, that it's done. The beta cells of your pancreas that make insulin are just shot. It's not true. I've done multiple reviews of studies over the years that even 10 years later, there was still, something called C-peptide. So when the pancreas makes insulin, it makes proinsulin, which is two parts, and one part is C-peptide, one part is insulin, and so you can actually check C-peptide to look at whether the pancreas is actually still making insulin. And so we know that, even when, by the time somebody has a diagnosis of an autoimmune type 1 diabetes, about 30 to 50% of their beta cells are still functioning. We don't think of that. We think that they're gone, and that's not true. And as I mentioned, that can go from months to years later. Now, in a child, when the body starts the autoimmune process, there is something called a partial clinical remission, the honeymoon phase. So essentially, it kind of starts and then stops and then ramps back up again. So if there's anything we can do to halt, derail, or affect that process, it's a good thing. Um, so something else I need to clarify is that, where does type 1 diabetes come from in the first place? There are two things that are very heavily on the list. I do not think that it's completely random. I think vitamin D plays a big role in autoimmunity and onset of autoimmunity. We're going to talk about in a second is vitamin D plays a much bigger role in prevention than it does treatment. The other thing is gut flora. Autoimmunity deriving, so antibiotic use as an infant or toddler, those throw off the immune system and set people up for autoimmunity. So those things are pretty well established in the literature to lead to an increased risk of type 1 diabetes. That being said, this was a study done on 36 youths, so we're talking about kids. They were randomized into control, or they were given high dose vitamin D, 50,000 units per week for 2 months. Now, you say high dose, that's about 7,000 a day, but I don't consider that high dose for an adult. I do for a child. But again, hammering this with vitamin D, which plays a big role, a lot of hype and drama associated with vitamin D. There are a couple things that is very well accepted, and one of that is managing the immune response, all aspects of it, including autoimmunity. So they found that these kids had not only their A1C was improved, but also their partial clinical remission, so the PR, was lengthened and had a positive impact on that. So something as simple as vitamin D, this 50,000 IUs per week for 2 months, and I would suggest that we could argue that we'd want to use that forever in these particular scenarios. You're looking at like a couple bucks worth of therapy to be added on to anything else that we're doing, and diet. It's a no-brainer. This is not the first time we've seen vitamin D playing a role in progression. So if for some reason you have a child that is maybe seeing a pediatric endocrinologist or their primary care doctor and has type 1 diabetes and they're not mentioning vitamin D, maybe it's time to find one that has cracked the medical literature in the past decade. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.